cumulatively recorded 301 cases since the outbreak. And in terms of death, the death toll remains at 3. As of the latest update from the Zambia Public Health Institute, they were dealing with 57 active cases, but from that 57, only 5 were confirmed to be positive. And then in admission at the moment, there's 0 because the rest of the patients are being managed on home-based care.
Just for clarity, Chillinda, the first case was, of course, confirmed in October last year in Chitambo, Central Province. Was the first case internal or it was imported? And perhaps also just shed more light of this, 5 cases.
All right. What actually transpired is that that particular case was imported from Tanzania. That is what the investigations revealed. And most of the cases came from that particular route. However, with time, there were also some internal infections that happened within the community, especially around the border town of Konde.
And just talk to us about some of the measures government has put in place to prevent the further spread of the Mpox, Chillinda.
Yeah, the most active one is sensitization. The government has been doing their best to sensitize people on measures they should. They should actually observe to avoid further spread of disease. From that, I think there's been proper home-based care that has been happening for those that are affected. And I must also ask them to say that so far, I think they have managed to treat and isolate the cases, and no longer as threatening as it was a few months ago.
You seem to be breaking up a little bit, Chillinda, but just finally, before we let you go, because we can't hear you that very clearly, Zambia is also battling cholera there. Just talk to us about the situation briefly.
All right. On cholera, there are currently 13 active cases. And then maybe I start by cumulatively, Zambia's recorded about 469 cases since the disease broke out in August. So there are 13 active cases. There are 4 recorded deaths. And the latest is that 16 were discharged, and cumulatively 446 people have recovered from cholera since it broke out in August.
Chillinda, would you say that the government has the capacity to deal with this particular outbreak?
Yes, indeed. Already on Monday, the government launched yet another vaccine for malaria. But for cholera, there's already a vaccine. And as we speak, 225,000 people have been vaccinated against cholera in the cholera-prone areas. And then the Ministry of Health is well stocked with enough medicines and chlorine as a preventive measure, as well as ORS, oral rehydrated salts, to deal with the disease. I think this is why the numbers are not as threatening as it was in the past. So I think government is well equipped. It's cooperating partners, including UNICEF and the World Health Organization. They're actually doing their best to contain the disease. As you may be aware, Zambia is quite a country with over 20 million people. So we have communities that are also in millions that makes the spread of cholera very fast. So I think government has the capacity to deal with the outbreak of cholera. Very soon it may be contained, except we're approaching the rainy season, and that is where now I think the challenge will come in. But I think the vaccine has been intensified in all the cholera-prone areas.